Well, my name is Shane. This is my last week of shifts. So if you don't know me by now, you probably won't, uh, which is awesome for me. So initially, my lecture was going to be on the science of wearing pink on Wednesdays. So the idea of wearing pink came from the 2004 movie Mean Girls, which won the 2005 MTV Movie Award for Best Female Performance and Best On-Screen Team. And it was turned into a Tony-nominated Broadway show, and then it was remade in 2024, so it should be culturally relevant for everybody in this room. My original lecture outline was built with the intention, that I was going to convince everyone once and for all that we should wear pink on Wednesdays. I had a ton of research that I was going to discuss about the benefits of wearing pink. I was going to talk about Dr. Satopshi's review and how wearing pink was as effective as 2 doses of the Moderna. I was going to critically appraise Dr. D'Souza's meta-analysis about how pink decreased your likelihood of getting yelled at for using inappropriate medical lexicon. And I was going to talk about Dr. Silverberg's trial that showed how wearing pink made the ultrasound as quick and as effective as the physical exam. And then the November 5th election happened. And after Donald Trump was elected, he started making really bad decisions about who should be put in charge of the healthcare of our country. To head our Health and Human Services Department, we have RFK Jr., who was nominated and now confirmed. And I've written a few of his greatest hits on the slide, but he's made claims like vaccines cause autism. He said that we should prosecute Fauci for not giving Americans ivermectin and hydroxychloroquine for COVID. He said he doesn't think that HIV causes AIDS and instead blames it on party drugs and poppers. He said that that Wi-Fi degrades the blood-brain barrier and makes it easier for us to get meningitis. And lastly, one that until he started talking, I hadn't thought was too controversial, but he wants to take fluoride out of the water supply. Trump then nominated Dr. Oz to be in charge of the Center for Medicare and Medicaid Services. Dr. Oz had previously sold people green coffee bean extract as a weight loss supplement without any evidence. In fact, there was one review that randomly selected 80 of his different shows and found that only about 46% of his recommendations had any evidence at all to support it. He told people that they should take actual silver for infections and diabetes, while the NIH, well, currently warns that it can cause damage to our kidneys, liver, and central nervous system. Oops. And what might be most problematic for our government is that he said he wants to do away with employer-based healthcare, Medicaid, and the ACA, and instead put everyone on a Medicare Advantage plan. And does anybody know who the largest provider of Medicare Advantage plans are in the United States at present? It's none other than United Healthcare, who notoriously set up their AI to deny claims for healthcare reimbursements and didn't change that algorithm after they identified that it was inappropriately denying claims. So in light of what has been a rough start to what will likely continue to be a tumultuous next 4 years in healthcare, I figured that I would discuss the topic of healthcare advocacy. So let's talk about a little bit why you should be an advocate, the Sisyphean task of being an advocate, how can you advocate, some examples of advocacy, and just a general summary as per the course. So I would understand why someone might have the question, why do I need to be an advocate? Aren't there huge groups of people that already do this? Can't they do it instead? What if I just want to work and go home? And to that, I would argue that we work in a unique profession. Before we got our degrees, we did take an oath, and the oath talks about how we should consider the sick as intertwined within society, and we need to consider how the sick can affect the well-being of both their family and the economy. And there's also an argument to be made that we have an obligation to promote good public health policy, as prevention of communicable disease is bigger than just one-on-one interactions with patients. And lastly, the oath reaffirms our role in society as individuals who have agreed to undertake the special obligation to prevent disease and help our fellow humans in our community. And we can see evidence of this social contract in the way that we speak about crime. Christopher Dunch famously maimed and killed people in his role as a physician, but this is America, and people are murdered thousands of times per year. What made it show-worthy is the fact that there was something more heinous about a crime like this, which is that there's a violation of the social contract that physicians have with people and our communities. And so, as professionals with this unique societal contract, One of the skills that we are developing is to be effective storytellers. Every day on shift, we collect stories from patients, and then we retell them to our attendings. The same thing is true when we advocate for our patients and our peers. In healthcare advocacy, we're telling the stories of our patients to legislators or newspapers to try to drive improvements in the care that we can deliver. And on the topic of trying to improve care, there's this concept of the aggregation of marginal gains, with the idea being that if we can just put in just enough energy so that there's a 1% improvement, that this then leads to incremental and compounding improvements over time. However, the opposite is also true in that a 1% decline will also start to accumulate into something much worse. And to that point, if you do nothing, others will continue to do something. And other doctors have advocated successfully for things that many of us would agree is objectively bad. One of these groups is America's Frontline Doctors, and here they say that they're interested in freedom and liberty. These are technically healthcare advocates, and they're advocating for COVID vaccine skepticism and the use of unproven and harmful therapies for COVID, an end to gender-affirming care. And just as a reminder, the founder of this healthcare advocacy group is an EM doctor. Another emergency doctor who we see here speaking in DC is Stella Emanuel, and she thought that scientists were making a vaccine against making people religious. She's claimed that alien reptile DNA was put into our medications. And she said that STDs and miscarriages were caused by having sex with astral projections and demon sperm. She's also described as having an important voice by President Trump. We also have the Do No Harm Coalition, who state that their goal is to protect healthcare. They don't want to protect it from profiteering, but instead, their healthcare advocacy is aimed at ending DEI in medical education and also putting an end to gender-affirming care. One of the fruits of their advocacy was the introduction of the Educate Act, which was federal level legislation that was attempting to stop medical schools from receiving any sort of federal funding to include student loans and research grants if the schools had any sort of policies or curriculum surrounding DEI. And the founder and chair of their board is a nephrologist. So what do we do when the individuals who we might consider brainless or heartless are also the ones with the ears of the people who make decisions either at the federal or the state level? Or what do we do when the insurance companies, the pharmaceutical industry, or the hospital lobbyists are routinely advocating for healthcare to be bent towards profiteering and their financial bottom line? And the answer to that question is that we have to learn how to be good advocates. And changing complicated bureaucracies can sometimes seem Sisyphean. As lifelong students, many of us are products of this academic medical culture, which is a meritocracy. We assume that if we work hard enough, that we'll be rewarded with success. And that's the mentality that got many of us here today. But with healthcare advocacy, there aren't really any rules. Then there isn't a guarantee for success just because you worked hard. Perhaps the saddest modern example of this was the repeal of Roe v. Wade, where we know there was lots of work that was done to make sure that patients had access to safe abortion care. And some people dedicated their entire careers to making sure that this was a reality, only for one conservative Supreme Court to completely undermine decades of those endeavors. So how do you become an advocate? Well, there's several ways that you can contribute, either through the government or through our local organizations like ACEP. I'll speak briefly about political action committees and how to use the internet for advocacy. So one of the benefits of the social contract is that people care what we think and they trust us when we speak. So you can get involved with organizations that can help you engage with your local elected officials. One way to speak to our local elected officials directly about the issues that concern you is to get engaged with CIR and their political action committee. And through them, you can speak with our congressional leaders. This is State Senator Jabari Brisport and Councilmember Sufrant Forrest. This is the Brooklyn Borough President Reynoso, who actually had quite a bit to say about Kings County. And then he gifted our Brooklyn Patient Care Trust Fund $500,000. And he was one of the people that made it possible for our program to get that $75,000 TEE. And I'll throw this out here just to show you how accessible they can be, because this is a bunch of photos of residents with city council members. We have Crystal Hudson, Chiose, Sandy Nurse, and Rita Joseph, who's our city council member for Kings County. And then this is John McMahon. So it's super accessible. And it's important to remember that the politicians will listen to us, but we just have to put ourselves in front of them. And anecdotally, these politicians see EM doctors like they do Jon Snow, because we're kind of like the perfect protagonists. We have the best stories and we take care of everyone and we don't care about people's ability to pay. So you can also get involved with EMRA and ASAP, and these are accessible to everybody right now. New York ASAP has a resident section, but it also has a government affairs committee that you can join. The AMA also acts as an avenue to give you a platform for advocacy. And for the EMIMs, you have ACP and New York ACP that you can get involved with. Some of the venues available to you include the Health Policy Academy through EMRA and ASAP, and they'll fund you to go to ASAP's Leadership and Advocacy Conference, where they often have leaders from Congress and the Senate come talk to EM doctors. And this event leads to a walk on the Hill, with this being the New York group from last LAC conference. And we spoke to staffers both at Senator Schumer's office as well as Senator Gillibrand's office. Other options for funding this is that the New York ASAP has a Leadership and Advocacy Award, which is due November 14th for anybody interested. And they'll give you $1,000 and pay for your registration, which is about $275. And Kings County has actually sent a good number of residents to this conference on this award over the last several years, and they usually take about 3 residents per year. And then this is the ASAP newsletter. And here you can see both myself and Pierre, because we both had the opportunity to walk around the Capitol to speak to our New York representatives. And ways that you can get involved in a more organized way is by doing an elective through either EMRA and ASAP, which is a 4-week-long elective in DC where you can work on Capitol Hill, and it's available to residents, fellows, and young attendings. And if you're an EMIM, this is one that I did. New York ASAP has a 4-week elective where you work within our state government alongside New York ASAP, or ACP. And one way that you can push your local groups, whichever you choose, into advocating for something that you believe in is by submitting resolutions. And medical groups like AMA, EMRA, and ASAP all have templates and points of contact if you decide to do this. These resolutions are written by regional chapters like the New York chapter of ASAP, particular sections of ASAP, or sometimes they're written by individuals. And here we can see an example of healthcare advocacy, showing how these groups and individuals came together to ensure that our patients were protected in the event that their pregnancy was threatening their life. With the net effect, I'll let you read that, being that ASAP is going to use its lobby money to work with state and federal governments on behalf of these patients. And if you don't want to write a resolution, you can still contribute by providing testimony on a resolution written by other people. This process lets groups like ASAP know what you think about their proposed resolutions. So if everyone says that they're in support of the resolution on their public testimonial page, then it's more likely to be accepted, and a group like ASAP can then pursue working with legislators to make something happen. Alternatively, if everybody says that they don't want it to happen and people are disagreeing with it, then it's less likely to pass. And so these resolutions and these bodies ultimately can act as tools for us to protect ourselves and our patients. So when you adopt a new policy, it allows for your group to file lawsuits, publish statements, or donate. So when we have issues, they can be there to advocate for us and our patients. And this does not have to be the AMA. This can be any organization like EMRA or ASAP. And as a side note, I made this slide before the RFK confirmation. And the AMA leadership actually acted quite pathetically, and they didn't really say anything regarding his peddling of vitamin A in lieu of vaccines. And so that actually makes the resolution process even more important, because if it can move your board members to make decisions when they're not willing to do it on their own. And if you don't want to join or work through those specialty societies, then there are other healthcare advocacy organizations like New York Docs, New York City Against Segregated Healthcare, or the Physicians for a National Health Program here in New York. Another way that you can get involved with politics, with the politics of healthcare advocacy, is through political action committees. These PACs deal directly with giving money to politicians, and they donate money to those politicians who have a history of supporting things that the specialty groups support. With this being the explanation on the NEMPAC website, and that's the one for ASAP. So you can see who they gave money to and for what bills they're attempting to get passed in Congress and the Senate. Oftentimes these candidates and elected officials also have to meet with members of the PAC, and they have to fill out these lengthy questionnaires to assure that their values align with those of the PAC. The added benefit to this is that these groups then develop relationships over time. And so when the groups need help, they can contact the representatives that they've been giving money to for support for new federal or state legislation. And ASAP did this recently to help promote the bill that would increase the availability of inpatient psychiatric beds to help offload emergency departments that had a lot of psychiatric boarders. So if the idea of writing resolutions or joining committees seems like too much, then you can always donate a small amount of money to the PACs, and then they can use this pooled money to support candidates, with the added bonus being that if you donate $120 to an MPAC, you get free food at conferences like LAC and ASAP. So another way to be an advocate is to email or use social media to try to connect with your local elected officials. This graph was from a survey of congressional offices, and short of visiting them in person, personalized emails actually held quite a bit of positive influence, and it came in third both with regards to having some positive influence and a lot of positive influence. And I'm just curious if anybody can guess how many tweets or mentions it takes for a congressional staffer to take notice of an issue. Give me numbers. 10,000? 5. 20, 30, 100. It's actually 10. So 5 was the closest. 10,000 had the right number in it. So it takes about 10 tweets or mentions or about 10 emails from constituents for congressional members to take notice of an issue. So hypothetically, to use social media to advocate for something like plexiglass barriers at Kings County, which we now have, it would be less effective to post something like this, and much more effective for a group of people to post something like this, where you mention the city council member with Kings County in their district, so that the member and their staff start to pay attention to the issue that you care about. And so this is an example of a sign up form for emails from New York ACP, and they'll let you fill out these pre-formed emails. And then you can edit the message and personalize it. And that allows you to contribute to campaigns without needing to spend a lot of time trying to craft the bodies of the email or trying to find contact information for your representative. And so this is an example of an email working to move representatives. A Bellevue resident had reached out to me regarding the poor lactation facilities at the Manhattan VA. So I emailed each of the offices of the city council members who sit on the Committee of Veterans Affairs, and the chief of staff for the chair of the committee reached out to me for photos and more information. And so I sent him several photos and just a brief description of the issue. So here we have the original room, which I told there was no signage even to find the room. And it was more or less just an empty exam room that was designated for lactation. And after the email, I was told that there were signs actually leading to the room. Here you can say that you can see that instead of exam room, it says lactation room with a nice sign that says, please knock. I heard that it was much more accessible. And while I have not used a lactation room myself, and I can't speak for the inside, the residents told me that they were much happier with it. And so this is a slide from a webinar that I watched back in 2022. And this is Dr. Eileen Barrett, who told a story about how her hospital in the Navajo Nation did not have Navajo interpreters and how she bore witness to the harm that it was causing to patients. And after hospital administrators refused to fund adequate interpretation services, she reached out to her senators and her local congresswoman, Deb Haaland, and their staff called the hospital, and within 24 hours, they had in-person interpreters. And for those of you who don't remember, we used to only have 12 hours of Haitian Creole video interpretation available during the day, and we had about like 4 Stratus devices for the entire department. So I spoke to Dr. Barrett to get some ideas on how to improve our interpretation services at Kings County, and ultimately use CIR to try to ask our administrators to invest in better services for our Haitian patients. And they suggested that we should use family members if it was an emergency, said we didn't need Haitian Creole discharge instructions, which we still don't have because Haitian people, so they can read French anyways, and that they had no intention nor money to improve our services. So we spoke to the city council about it. And after a few letters from them to our hospital CEO and Mitch Katz that went unanswered, there was a city budgetary hearing where they confronted him directly and residents provided testimony at. And the net result of that interaction was that Mitch Katz committed to improving our interpretation services. So now we have 24/7 Haitian Creole video interpreters. They created a Haitian language corps. I know we switched to Proprio, but they did buy 60 of the Stratus language devices for the entire hospital. And more importantly, is they currently have hired, there are 3 people on our payroll at present who are supposed to start working in the spring of 2025. So I hope that the people in this room hold our administrators accountable to the promises they made both to us, our patients, and the city council. On a more local level, You can be the voice of healthcare workers at one of our 59 community boards in New York City if you're passionate about a project or a topic, with these boards being made up of about 50 members from the community that are appointed either by the borough president or city hall officials. Anecdotally, this is one of the places that I went to get support for our pay raises. And these groups have health and social services committees, and any community member is free to sign up and speak at this. One important way to advocate is to write op-eds, and you can use local blogs or newspapers to write editorials or spread awareness to advocate for the healthcare of people who cannot advocate for themselves. If you remember from our earlier graph regarding how effective the different strategies are, this is about as effective as personalized emails to our congressional staff members when trying to catch their attention. So in closing, the overarching theme of this presentation was to provide you or rather to remind you that if you aren't actively trying to be a part of the decision-making process, people will make decisions for you in ways that you may not agree with. This extends to getting engaged with hospital committees as well as government advocacy. And you won't know if your efforts will actually change anything. However, without trying it, you will never know. So in summary, you can either be angry about something in isolation, or you can turn it into action, either by joining a physician advocacy group, writing resolutions to move our larger physician groups to lobby for change, or donating to PACs. You can send unique emails and personalized emails, mentions, or tweets at your representative, because if enough people do it, they'll actually start to kind of get wind of an issue. And lastly, you should wear pink on Wednesdays. This is going to be my questions page, but I found a list of doctors in Congress, and I really didn't know where else to put this slide. But these are all of the ED doctors in Congress. And one of the, I guess, like sadder things was that these are all of the OBs. And Kelly Morrison is actually the first pro-choice OB-GYN in Congress, which means that before this last election, every specialist voice in Congress has been a male voice against reproductive rights for women. So that's it. Thank you for the memories. And that's bye.